Okay, so hello everyone from all time zones, and thanks Cristiano for inviting me. The topic of my talk is borders, and I think this is an unusual time to speak about borders when COVID-19 crosses all borders, and when we ourselves need to constantly re-examine our boundaries to contain the pandemic, but also to keep the human spirit in these difficult times. I'm just looking at the time at my place. So I hope that my presentation would be of some help to keep your brain working, to lift your spirit, or just to meet new people here. So let's get started. We keep crossing borders, and I'd like to think for one moment about the meaning of borders. So some cultures even encourage border crossings, just as my own Israeli culture, for example. Thinking out of the box is considered to be a virtue among many professions, and the personal relations are usually also very informal. On the other hand, as we noticed, the habit of maintaining social distance and boundaries can save many lives in these crazy times. And what about professional borders? How do we how do people who left their borders recently and still haven't defined new boundaries relate to personal and professional borders? What do they do when they have to adapt new professional borders, those of community or medical interpreters? So what do actually borders mean? When we look at dictionaries, we think about belonging versus separation, inside and outside. Borders also mean ownership of a space, inclusion, exclusion, and of course, discussing borders must relate also to border crossings. Professional borders is one of the most discussed topics in interpreting studies in general and in public service or community interpreting in particular. Due to the understanding that community interpreting involves people, interaction, inequality, and complicated situations in general, we are taught early on our professional lives what our professional boundaries are. The discussion of boundaries in community interpreting does not relate anymore only to the normative borders, for example, the code of ethics and best practices of interpreters, but also to this potential gap between preset rules and life itself. And life dictates its own borders: gender, religion, culture, or legal borders. They can be part of the interpreter's own cultural capital or acquired or imposed by the environment. My presentation today is based on a paper that I published with Dr. Jonathan Giz. And for our study, we followed sociologist Ervin Goffman's discussion of borders that was elaborated later to interpreting studies by Cecilia Wadenscher. Goffman describes a tension between what he calls normative and typical roles. A normative role or primary adjustment means, according to Goffman, straightforward conforming to institutional demands, doing what expected in the framework of one's social role. Typical role or secondary adjustment are moments in which the professional or position holder strays from the script, so to say. In such a situation, as Wadenscher explains, interpreters developed routines of dealing with typical situations that are not foreseen by the codes of conduct or any other professional norms. Consequently, those behaviors might involve slippage or border crossings. And I'm sure those of you who are interpreters or interpreter trainers know exactly what I mean by border crossings. Ingileri, another interpreting researcher, discusses the contradictory position between one's initial or acquired habitus and that of a professional context. She points out the specific potential aggravation of interpreting from asylum-seeking communities because of their social vulnerability and their legal in-between status. They escaped from one country and did not yet receive a final status from another. This is exactly what happened here in Israel, and we'll get to that in a minute. Of course, those interpreters need to review their social boundaries as well, as they now live in another society with different boundaries, perhaps. However, those interpreters still live and interact closely with people from their own culture and community, people with the same social boundaries who also struggle in the larger host society or the new society and with the bureaucracy of obtaining a new legal status. My case study for examining those secondary adjustments or zones of uncertainty were people from the Eritrean community living in Israel after their medical interpreting course in 2014. A few words about the Eritrean community in Israel. Asylum seekers, or as they are sometimes called, infiltrators, started arriving from Eritrea around 2005, 2006. Their influx was growing rapidly, and then it stopped at about 2012 after a fence or a border between Israel and Egypt was built. So today about 35,000 people from Eritrea are living in Israel. They receive what we call collective protection or umbrella protection. That means they cannot be deported, but in fact, their refugee status requests are not discussed at all. So they live in Israel about a decade or more, sometimes without status or any work permits, and with very limited access to welfare and health services. They live in their own communities. They do work in Israeli places, but they don't really get well integrated. They suffer from stigma, of course. They live in poverty and they have their own hardships. And of course, not to forget, you know, the circumstances in which they came from Eritrea and the hardships they went on the way to Israel. Sometimes some of them were tortured and other horrible things. So getting back to the training in 2014, this was the first academic training for Eritrean interpreters and cultural brokers. It was conducted in partnership with universities, the biggest hospital in Israel, and UNHCR. The training lasted a few months, and it included 60 hours of theoretical training, which is considered to be quite a lot in Israeli terms, plus 10 hours of practical training in a hospital or a clinic as interpreters. The participants were carefully selected. Some of them were already working as interpreters in NGOs that provide health services to asylum seekers, for example. Others were with the skills and the willingness to interpret it, but also one selection criteria was that they were some kind of leaders or role models in their community. Just to quickly, I will go through the content of the training, even though this is not the focus of my presentation, just to show you that I think the themes are well known to people who deliver medical interpreting trainings. So the structure of the Israeli healthcare system, health rights of asylum seekers, basic human anatomy and physiology, medical interview, some common medical problems and their treatments, medical procedures, common medical procedures, and hospital tour. Some of them did not visit a hospital before, you know, luckily, so to say, but they had no idea how a modern hospital looks like. From the interpreting point of view, as you see, the contents were similar to other interpreting courses that I know of. Basic concepts of interpreting and translation, some techniques to consecutive interpreting, which is what they will do, best practices and ethics, of course, medical terminology, psychological effects of the interpreter's work, like burnout and vicarious trauma, intercultural issues in the work of interpreters, and so on. So a year after the course, an independent researcher interviewed all graduates, 16, mostly face-to-face. One participant immigrated at that point, so there was a Skype interview. And the researcher asked them some general questions about their lives in Israel, their training, their work as interpreters, and other works they had, as well as future plans. One of the themes that the researcher and then I myself identified in this corpus was their references to borders and boundaries. So we looked at what they said and we were able to make some typologies. And this is basically how it looks like. So you can see the formal interactions inside the clinic or the hospital, informal clinic, things that happen outside the institution, and borders that relate to the provider and the patients. So in situations that occur inside the institutional setting, these participants clearly define and adhere to normative roles. Sometimes it's in contradiction to what they did before the training as untrained interpreters. They now refer to my duty, my task, my uniform. The community obviously asks them for more, but they refuse and clearly mark those boundaries. For those who worked as interpreters without training, this may have been the first time that they marked those boundaries. For example, one of the respondents who now said he interprets bad news without changing the message, which is what he did before. He softened the message and now he says, now I know it's my work and this is why I took the course. Another interpreter wears the doctor's white gown in a hospital and his compatriots call him doctor out of respect, of course, and maybe they expect him to act like one. So he corrects them. He said, I'm not a doctor, I'm only a translator. So he marks the boundaries despite, you know, this honorable uniform. Other interpreters gave examples of various ethical principles such as impartiality, accuracy, and confidentiality. Some professional behaviors, accuracy, for example, may require interrupting the doctor or the patient to ask for clarifications, as we teach the interpreters. This is considered to be something which is culturally impolite, so to say, according to a few respondents, but they do this for the sake of the role. So they have to perform something which is contradicting their, you know, cultural norm, but confronts or adheres to the ethical principle they just learned. Interestingly, cultural brokering is considered to be working within the boundaries and not as borders crossing, as we can see from the example on the right, bottom right, an interpreting asking the doctor's permission to ask the patient what the cause could be of something. A person told that he had only 2 children, which is culturally odd to have 2 children in 12 years. So he felt the need to ask if there was something wrong, so to say, in this situation. Outside the clinic with the patients, however, is the place where borders are blurred and re-examined on a daily basis. The Eritrean community is not very big, so these interpreters may meet the patients or the clients on a daily basis, you know, on the place they live. They cross the borders sometimes, but it seems they can explain why they do it. One major reason for border crossing is, of course, the empathy they feel towards their compatriots. They have gone, and some of them still face the same hardships in Eritrea and on the way and in Israel. A second reason is the community's expectations from them. A person who gets education or acquires a profession is expected to help his community. So if you're a medical interpreter, you're supposed not only to serve as a language mediator in the clinic or in the hospital, but rather help your compatriots in the other hardships that are related to the medical system in large, so to say, or assist in medical situations. So one interpreter even told us that he was called in the middle of the night to actually help a woman in labor, not interpret her, but help her give the baby. These two examples show how interpreters mediate on these zones of uncertainty, where the professional conduct contradicts the habitus, or the habits, skills, and dispositions they acquired from the community of origin. Some interpreters try to limit this extra involvement or border crossings to outside the clinic. They distance the situation to the client's house or a cafe, even when the request for help was made in the clinic itself. So if somebody asked for help in the clinic, they would either meet him in a cafe or go to his house, even though they know they're not supposed to do this. Maybe this is the way of maintaining the professional boundaries as much as possible within the institutional premises. So realizing these complex concepts of boundaries with primary and secondary adjustments, we need to think how we teach those interpreters to face real life situations which put to question their professional and social boundaries. Despite a complicated legal situation and the fact that there is no academic training for those asylum seekers, we do have opportunities to relate to this complexity. So since 2014, we had actually two other similar trainings, one in 2018 and one last year, in which my own perceptions and practice as an interpreter trainer already addressed the complexities that we found in our study. So when we discuss borders with the students, we must acknowledge the fact that they will face situations where borders are questioned. We cannot just tell them, don't do it. We have to understand the context in which they live and work. We should try to foresee those borderline situations and discuss them with the students, how to, for example, how to deal effectively with them, not only for the sake of the clients, but also for them. We should ask with them, how can they use their acquired cultural capital? This is the newly defined role of a professional interpreter or mediator, how they should use this capital to help their community dealing with the daily hardships, but still draw some boundaries, and no less important, minimize the risk of themselves, of burnout and other psychological negative effects. In Israel, there is no established code of ethics for community or medical interpreters, excluding the code of ISL interpreters, Israeli Sign Language interpreters. I use their code, or the IMIA code of ethics, as a reference point, but some practitioners or some practices, may be irrelevant or unpractical for some cultural groups in Israel. So there is actually a need to revisit the spirit of such code and adapt it to the social and legal status of particularly vulnerable groups, such as new immigrant groups or people that are still waiting for their legal status to be determined. So just one quick example from the training that we had just a few months ago. This is an excerpt from their attempt to define an ethical code of cultural mediators. So they have the concept or the rule, and then they have dilemmas. So we realize, that there is the code and the rules, and there is life itself, and the discussion of dilemmas actually gives legitimacy to the possibility that they will meet situations in which they feel they should act otherwise, or that they should feel, cultural or social obligations to act contradictory to the code. So instead of just learning a preset of rules or norms, we are discussing them together with dilemmas and how to analyze the dilemmas and sometimes choose the not the best solution, but the less worse solution in this particular situation. So the study made me more aware of the situation that Eritrean interpreters face, which stresses the importance of research performed by interpreter trainers. We need to understand not only why we do, what we do when we train, but also why we do it and how this affects the students, the clients, and the profession. The more we are all aware of these complexities around borders, the more I think professional the interpreters will be, while not really brutally breaking their social and personal obligations. Maybe we should consider those interpreters as multiple role performers, as Goffman calls them. They actually walk between the raindrops while reenacting their professional and cultural roles. So maybe I think this course and the other two gave me an opportunity to review those zones of uncertainty and create more legitimate professional or social practice for community interpreters. I wanted to finish with a thank you, but I think the more appropriate blessing right now is just take care. And thank you for being with me and listening. And I really hope this is the beginning of, an interesting discussion. And thank you for Talia for interpreting.